Good morning, everyone, and welcome to today's webinar. I'm Anne Livingston. I'm the chair of the Community Care Smart Assistive Technology Collaborative, and I'm going to be the moderator for today's webinar. We've had lots of interest in today's webinar titled How Artificial Intelligence Can Be Used to Manage Dementia. Our webinar today, as in with other webinars, is hosted by Global Community Resourcing. We're an Australian-based company with extensive international links on innovation in community-based service delivery. This webinar is part of one of our main projects, which is the Community Care Smart Assistive Technology Collaborative, which was set up by the Queensland Government, but with a reach both nationally and internationally. It really was an opportunity to bring people together, particularly community care providers who are interested in collaborating on issues and practices related to smart assistive technology. If you've joined us in previous webinars, you'll know that they are designed from feedback from our members. We've got over 2,000 collaborators and several projects operating as a result of those collaborations. Our focus of our webinars is to bring together local, national and international perspectives on real leading research and development, as well as highlighting deployment of technologies in the community care sector. Just a reminder, if you're not formally registered with the Community Care Smart Assistive Technology, you can do so. It's free for all, and the registration link is on your screen now. Just in terms of our independence, I just need to make a declaration that although we hold many of different webinars showcasing research and projects as such, neither Global Community Resourcing or the Department of Communities, Child Safety and Disability Services promoting or endorsing any particular product, research entity or organisations. Rather that our webinars really are about informing viewers of examples of really good developments and great research happening in the area. So in this webinar, it's my pleasure to introduce Professor Sandeep Reddy, a renowned researcher in this area, in this new area of artificial intelligence. And he's going to explore through his presentation how artificial intelligence can be used to manage dementia. Professor Reddy is an artificial intelligence in healthcare researcher based at Deakin School of Medicine. He's also a certified health informatics, as well as a World Health Organization recognized digital health expert. His current research relates to safety, quality, and explainability of the application of AI in healthcare delivery, in addition to developing AI models to treat and manage chronic disease. It's my pleasure to welcome you today, Professor.
Thanks, Anne. Thanks for the kind introduction. So I will start sharing my screen now. So thanks, Anne, for the kind introduction. Today, I would like to discuss how artificial intelligence can be used to manage dementia. And the outline for today is, before we get to how artificial intelligence can actually manage and help with dementia, I would like to briefly introduce you to what artificial intelligence is, the different types of artificial intelligence, and how artificial intelligence is applied in healthcare broadly, before we actually get to the part of dementia, what dementia is, and what's the general management principles for dementia. And then we'll go into specific cases where AI is being used to manage dementia. And then if you have some time, we'll go through the question and answer session. I won't talk about myself because Anne has kindly introduced myself. Just want to emphasize that I'm actively involved in AI and healthcare research. So it does kind of provide some backing to what I speak today. Now let's look at the definition of artificial intelligence. If you go to different sources, you get different definitions. So it might be very confusing, and some definitions are really very jargon oriented, very technical. It's hard to remember. I've devised this definition, which is actually a true reflection of what artificial intelligence today is, as machines assuming human-like intelligence. And depending on the technology, the extent of the assumption of simulation varies, but the general principle is that machines are assuming human-like intelligence here. Now, when we look at the history of artificial intelligence, going by what we read in the media and the recent attention towards artificial intelligence, we may have this misconception that artificial intelligence is new. In fact, it's not. The concept can be traced back to the 14th century itself, but it's only in the past 40, 60 years that's been more formalization of the discipline of artificial intelligence. And in the past 20, 30 years, that's been a renewed focus on artificial intelligence. And why is that renewed focus on artificial intelligence that has come to being? That's mainly because of three reasons. One is the emergence of graphical processing units, which are available in our regular everyday computers. And these are generally used for gaming purposes. But what computer scientists have found and other technical enthusiasts have found is that it's also very useful in crunching artificial intelligence algorithms. And that emergence of graphical processing units is fairly newish. And that's one of the reasons why artificial intelligence has reemerged. And the second factor is the emergence of big data. We're talking about terabytes of data, not your average megabytes of data. We're talking about huge volumes of data. And what has happened is your traditional software programming has been unable to analyze and crunch that data. You needed more powerful algorithms, and that's why artificial intelligence has emerged as a solution. The last part is not insignificant because of the renewed attention and focus on artificial intelligence. A lot of governments, agencies have now poured funding into artificial intelligence, and this has also accelerated the development of artificial intelligence techniques. So that was in brief the definition of artificial intelligence, the reason why artificial intelligence has a renewed focus. But now let's look at the types of artificial intelligence. Just like the definition, if you go to various sources, you get different categories of artificial intelligence. It can be very confusing. I'll try to make it simple into just two categories. So there is machine learning and there's robotics. Today, for the purpose of the webinar, we'll just focus on machine learning because this is the most commonest form of AI that's being used, whether it's in healthcare or in other industries. So what is machine learning? You may have heard of this term quite often, and I may have wondered what exactly is machine learning. Instead of me giving you a textual definition, let me direct you to this illustration. On the top part, you see the regular software program, and the bottom part, you see the machine learning. So in regular software programming, what you do is you feed in the data, whatever the data is, image data, text data, whatnot, and then you feed in the rules, or in other words, algorithm, and the computer then gives you the results. What you do in machine learning is you feed in the data and you train the the computer to recognize the output, and the machine itself devises the rules. In other words, machine is learning. That's why it's called as machine learning. And this is very good when you get huge amount of data where you can't sit down and create rules for each and every scenario. So then the machine comes into play and devises its own rules, is able to recognize the patterns. And as you feed in more data, the machine gets better, or the algorithm gets better. Now, within machine learning, there are various types. We'll talk about that shortly. But one area which has received a lot of attention and where there's a lot of accuracy and performance that has been seen is deep learning. Again, you may have heard of this term and wonder what it is. So deep learning is really about artificial intelligence and machine learning trying to simulate how human brains work. And when you kind of imagine the structure of the human brain, the underlying neural architecture, you can see there are neurons, which is the fundamental part of our nervous system. And these neurons are interconnected with each other. That's what leads to our cognitive functions, our memory, and other things that we do. So what computer scientists have tried to devise is try to simulate that kind of architecture in software programming, and that's how deep learning came into being. And you can see on the slide, you can see the replication of the human neural architecture in computer architecture. You can see the white circles, which are termed as neurons, and then those neurons are interconnected with each other by these lines called edges, but they're also organized in layers. And this is what leads to the performance of deep learning and makes it much more powerful than regular classical machine learning algorithms. And while it does provide that additional performance and accuracy, it also provides a situation where we won't be able to understand how the decision was arrived at. Normally in low risk areas, this is not a problem, but when you're talking about healthcare, this becomes an issue. We'll talk about that a bit later. Now, again, moving back to machine learning and trying to categorize the different types of machine learning. On my left-hand side, you see a form of machine learning, which is the most commonest, where we label the data. We use human experts to label the data, and that gets fed into the machine learning algorithm. The machine learning algorithm starts to recognize the data because it's been labeled. And when you present new kind of data, similar kind of data, it's able to then identify what is the target class or what is the area of relevance. So for example, in this situation, we say a CT scan, which has been a CT scan of the brain. We label it for whatever condition it may have, the pathology it may have, and then we train the model according to that images. And then later on, when you feed in a new CT image, it's then able to recognize what the issue is. And in the middle, you find another form of machine learning, which is called as unsupervised learning. The distinction between supervised learning and unsupervised learning is in unsupervised learning, we don't label the data. Say, for example, we have so much data that's humanly impossible to label all the data, or may not be able to even recognize what the data needs to be labeled for. So in this kind of situations, you use unsupervised. So this becomes useful when you don't have the time to label the data, or you don't have the resources to label the data. The machine learning algorithm itself starts to identify data with similar features that is not recognizable by human eyes, but it's able to be recognized by the machine. And then it groups together the similar kind of data and forms them into clusters. So that's why we use a lot of clustering algorithms in unsupervised learning. Lately, this has become starting to become popular because people have started to see the ability for this algorithm to crunch through huge amount of data that we were talking about earlier. The last one, which I wanted to mention briefly, is reinforcement learning, which is on my right. So here we see an ability for machine learning algorithms to learn the results through a process of reward and punishment. To explain this, say, for example, the machine learning algorithm is able to identify the results correctly, then you reward it. And then if it's not able to, you penalize it. So it's kind of a reward and punishment approach. And over time, because of that reward and punishment approach and optimization approach, the algorithm is able to recognize the results correctly. So you may start to think this sounds a lot of like science fiction, but actually we've seen very good results with this kind of learning, not in so much in healthcare, but in other areas. Some years ago, you may have heard of DeepMind, which is now a subsidiary of Google, devising an AI agent or AI model, which bet the reigning Go champion. Some of you may have heard of the game Go, which is a very complex game, much more complex than your average chess. So in order to kind of train an AI model, they use reinforcement learning, and that model was actually able to beat the reigning Go champion at that time. And that's when there was more attention paid to artificial intelligence and what it can do. So I know it was a quick rush through what artificial intelligence is. There's much more to what artificial intelligence is, what are the different types, the technology and stuff. But I don't want to bore you today, but I want to get back to what we are here for today, how artificial intelligence gets applied in healthcare and how artificial intelligence is used to manage dementia. But before we get to how artificial intelligence gets applied in healthcare, we need to consider, why do we need to consider artificial intelligence in healthcare? Isn't there enough solutions in healthcare, or does healthcare need artificial intelligence? First, let's look at the problems that healthcare services face. There are many problems, but I'm trying to highlight the important ones. First one, which we already know and very acutely aware, is there is a workforce shortage, whether it's doctors or nurses. There's a shortage of healthcare professionals. That's because it takes a long time to train healthcare professionals, but in the interim, you still have the demand. So there's a mismatch between the demand and supply. So you have the workforce. Second thing is we also know is that there is geographical and financial barriers to healthcare. People in rural and remote Australia can't get the same level of access to healthcare as you would get in urban situations. And then you also have financial barriers. Not all people can afford all types of healthcare. There's a issue too. And other issues that are prominent in other healthcare systems, but not so much in Australia, but still worthy of mentioning. In other healthcare systems, you are starting to see increase in number of medical errors because of human frailties. And you're also seeing doctors being burnt out because of the huge amount of work that they're facing. So with all these issues, there is definitely a consideration, there's a requirement for us to look at solutions. If you thought that issues weren't enough, there are more issues in healthcare. We also know that there is a growing aged population, whether it's in Australia or overseas, that aged population is increasing. But why is that important to healthcare? That's because in order to respond to that growing population, healthcare systems, healthcare models have to change. They have to readjust their healthcare pathways. They have to consider geriatric disease like osteoporosis, dementia, and so forth. They also have to train their workforce to respond to this growing age population. So that's also a challenge that healthcare services are facing. And if we thought, oh, that's not enough, here is another big beast, that's the chronic disease burden. And in fact, World Health Organization has termed this chronic disease as the biggest challenge health services face. It's actually much bigger than the pandemic that we are currently in, because if you talk about the magnitude of the diseases, which covers hypertension, hypercholesteremia, mental health conditions, diabetes mellitus, arthritis, and so forth, anything that lasts longer than 3 months. So this kind of disease actually is the most amount of conditions that health services treat and manage, and it also contributes to the highest cost that health services face. So naturally, it's a very big challenge for health services. So we do know now that there are a lot of issues with in terms of healthcare planning and service delivery. So we need to obviously look at solutions. So one of the solutions that I'm interested in, obviously, is artificial intelligence. And we'll now look at how artificial intelligence can be a solution. But before we get to that, let's look at the history of artificial intelligence in healthcare. Just like paralleling or reflecting what's happened with general artificial intelligence, artificial intelligence in healthcare also has been around for quite a few years, in fact, for decades. Way back in 1970, a physician wrote a paper describing how artificial intelligence can be used in healthcare. Since then, there have been introduction of models using classical machine learning models, classical artificial intelligence methods called expert systems. But those kind of systems or those kind of techniques weren't powerful enough to crunch through the huge amount of patient data. But lately, with the emergence of deep learning, which we discussed earlier, we found that this deep learning kind of models, machine learning models, can actually analyze and recognize patterns much better than classical machine learning approaches or classical artificial intelligence approaches. And that's why we have started to see more attention paid to artificial intelligence in healthcare. Now, when we look at how artificial intelligence gets applied in healthcare, I think pretty much every medical discipline has been indirectly or directly impacted by the use of artificial intelligence. And as years progress, we'll start to see more and more artificial intelligence techniques being integrated into healthcare. But if you have to look at a very high level, artificial intelligence can be kind of categorized into a couple of areas and how it gets used in healthcare. There's computer vision, which is the most popular one. We'll shortly look at that. There's natural language processing, which also we'll shortly look at. But machine learning itself is generally being used to create personalized medicine. Why is that important? As we start to do more and more research, we realize one size doesn't fit all. We need to personalize the approach we take. Whether it's chronic conditions or acute conditions, we need to consider the individual patient. But it's very hard to do that when we have workforce shortages, time demands, and also inability to crunch through data. So artificial intelligence to machine learning can help with that personalized medicine approach. There's also robotics, and we are not at seen the full or not yet exploited the full potential of robotics. In the coming years, we'll start to see more and more robotic applications in healthcare. Now, because of the time that we have, I won't go into all of the areas where AI gets applied in healthcare. I want to get into quickly into how artificial gets applied into dementia. But before that, let's look at a broad level how artificial intelligence gets applied in three main areas where AI is very popular. One is medical imaging analysis or computer-aided diagnosis of computer-aided diagnosis. And the second area is clinical decision support systems. And the last one is natural language processing applications. Now, when we look at medical imaging analysis, that is use of computers to identify lesions or any abnormalities in medical images, whether it's X-rays, CTs, or MRIs, or even histopathological images, that kind of use of computers has been around for a while. But it's lately because of the emergence of deep learning, especially a technique called convolutional neural network, that we have started to see more and more use of this particular approach in medical imaging analysis. This convolutional neural network, which is the one which has really revolutionized use of artificial intelligence in healthcare, has been very, very powerful in recognizing image or pixel-based data. So the reason that it does is, instead of me trying to walk through the technical details, let me direct you to this illustration where you'll see the architecture of the convolutional neural network, which what it does is basically breaks down the images into parts and then regroups them together to identify the abnormal area. So you basically train the algorithm to identify where the abnormality is, and then over a period of time after it's been trained on thousands of images, then it's start to automatically recognize what the problem is. In this case, there is enlargement of the heart, so it's able to recognize that. You basically train that. And this particular algorithm is very powerful in interpreting pixel-based images, and it's very good in hierarchical analysis. So that was in brief how artificial intelligence is used in interpreting medical images. In fact, that's where a lot of applications you see nowadays, and also in certain countries overseas, the government start to reimburse doctors to use artificial intelligence in medical imaging analysis. It hasn't still happened in Australia, but it's likely to happen very soon. So now when we're talking about the next area, clinical decision support system, again, just like computer-aided diagnosis, it has been around for a long time, but the introduction of deep learning has revolutionized the clinical decision support systems in making much more personalized treatment, because machine learning, as we discussed earlier, is much more powerful in analyzing big data and formulating personalized treatment approaches. So this is an area that I say watch the space as we see more and more of these trials of this clinical decision support system being held and being integrated in the healthcare system. You will start to see this in your regular day practices. You may walk into a general practice clinic or into the hospital, and you may see the doctors actually using these clinical decision support systems to formulate the treatment and the management plan for yourself. Now, why is that I have this interest in artificial intelligence-driven clinical decision support systems, or this confidence this is going to be integrated in healthcare? One is because we already know that regular software programs do not have the capacity to analyze the huge amount of patient data or clinical guidelines, and machine learnings are more powerful. But the other aspect is when you look at human doctors or any medical specialist, no medical specialist or no human doctor can say that they know everything about their discipline, because there's huge amount of data coming in through, huge amount of clinical guidelines coming in through, but there's also newer and newer forms of treatments, drug treatments coming in through. So in order to be able to digest all that information, you would need much more than your human brains. You need to be much more than human capabilities. And that's where artificial intelligence-driven clinical decision support systems can help, because computers don't need a break. They work 24/7, they work throughout the year, and they have much more capability in analyzing big data. So that's why I think the ability of AI-driven clinical decision support systems will be started to be accepted by the medical community. The last area where I wanted to focus in terms of artificial intelligence application in healthcare is natural language processing. What do we mean by natural language processing? So it simply means that computers are interpreting human language, whether it's oral or written. And this is not an easy task because, as you very well know, each language has its grammar, syntax, dialects, and so forth. And also there is accents. So even as human beings, we find it hard to understand somebody else's accents or somebody else's dialects. Now think about computers wanting to do it. It's not an easy process, but in recent years, we have started to see emergence of powerful techniques in natural language processing, which can analyze written text, analyze oral languages real time. We use everyday, smart assistants on our phone to ask for weather or ask for directions. So we already starting to see artificial intelligence in other areas. But now we are seeing artificial intelligence, natural language processing applications even in healthcare. So a couple of applications that are already being used is this triaging systems or symptom checkers. So there are a couple of applications in the US and in the UK. The one on the left is from the US, and the one on the right is from the UK. In fact, the National Health Service in the UK has actually contracted this company on the right to do some of the triaging virtual health assistants for their population. So what it does is basically asks for the patient what their symptoms are, and if it's something urgent, it refers them to the nearest clinic. But if it's something that can be treated at home or that doesn't require travel to the hospital, it states so. There is a bit of risk around that. It may sometimes give you incorrect information, but people are starting to accept that overseas. I also been involved in my research in using natural language processing and computer vision in addressing chronic diseases. And this application utilizes natural language processing, computer vision, and machine learning to help with diabetic patients, ensuring that diabetic patients, undertake changes to their lifestyle, but also are connected to the doctor and get necessary information when they do not visit the doctor, transforming episodic care into continuous care. Now, I talked all about benefits. You may say, oh, that's good. What about the limitations? What about the challenges? In fact, there are many, many challenges, and that's something people are working on, but I do want to talk about that now. One issue with machine learning and artificial intelligence, what we have nowadays is it's very, very narrow. It's just focused on a particular area. If you develop an AI model for dermatology, it works only for dermatology. It doesn't work for cardiology. You need to train another AI model for that. There is no single there's no single application which can cover multiple disciplines. You say, well, why is that important? But when you look at human doctors, a general practitioner, in the morning, the general practitioner may be dealing with geriatric medicine, in the afternoon with obstetrics and gynecology. So we're kind of, as human clinicians or human healthcare professionals, adapted to treat multiple conditions or multiple address multiple challenges. Artificial intelligence isn't so. What we have is a very, very narrow focus. That's one thing. The second thing is there is also technological limitations. Artificial intelligence applications require GPUs, and GPUs are not very cheap. Not everybody can afford those powerful GPUs or AI chips. So there is that technical limitation. The other issue is to do with data. The data that we require to train AI models is, while there's abundance of health data, not all of it can be used to train AI models, and not all of it is allowed for use for AI models. So there's also that challenge too. And further to that, there are ethical challenges. We've seen overseas where AI models have been used, there have been biases introduced, or they have exacerbated the disparities. What do I mean by that? When we use incorrect data to train the AI models, it also leads to incorrect results, garbage in, garbage out. So we have to be careful about that situation where AI models can give you incorrect results. But it becomes worse when you already have existing biases. We know that in Australia, Aboriginal and Torres Strait Islanders face a lot of health disparities. There's a gap between their health levels and the rest of the population. What if you were to introduce an AI model and that will exacerbate that bias or the disparity? So we have to be careful about the type of data we use. And the other issue is to do with the deep learning architecture. Remember, I was talking about those layers earlier. The layers add to the performance, but they can also lead to issues with the transparency. So that means we don't know how the decision making was arrived at. And that means also that it leads to mistrust. We won't be able to trust the decision, even though the AI application may say giving a correct result or maybe giving you the right approach to the treatment. You would not want to trust it because you don't know how it works. So based on those challenges, so if somebody were to come to me and say, where are we at with the maturity levels with various AI applications? I would say in terms of the computer vision, the medical imaging analysis, there's been a lot of studies, retrospective and prospective studies, to show that there is potential in being able to use that. Some studies have actually shown the performance of these medical imaging applications to be at the level of radiologists, level of ophthalmologists, level of dermatologists. So already here in Australia, the College of Radiologists has started to formulate policies to integrate AI into healthcare, obviously with caution, but we are starting to see acceptance of that. So I would say from that perspective, medical imaging and interpretation is at a very good mature level to start to be considered within the healthcare delivery. There is also virtual health assistants, if used for triaging, that we have seen overseas. It's quite good in terms of reducing the burden on the healthcare system, reducing the number of triage category 5 and 4 presentations at the emergency department. We already know that emergency departments across Australia face huge amount of stress and burden. So that virtual health assistants, symptom checkers can help alleviate some of the stress. Now, coming into the future, looking 5 to 10 years from now, we talked about clinical decision support systems and how they can personalize treatment approaches. And we're going to see more of that happening in 5 and 10 years from now. I'd say from 25 to 30 years from now, as AI technology moves from narrow AI to general purpose AI or strong AI, we're starting to see more and more replacement of some of the functions, not entirely, some of the functions of the healthcare professionals, and that's a while away. May also see robotic surgery, not the one we currently have like Da Vinci surgery, which is basically manipulation of robotic arms. What we're going to see is autonomous robotic surgery. So we should be able to see that 25 to 30 years from now. Okay, so now that was kind of talking about AI use in healthcare. Now let's get to the focus for today's webinar, dementia. Before I get into how AI gets used for dementia, I know that you're all experts and have knowledge of dementia, but just let's walk through what dementia is so we're all on the same page. We know dementia is not a single medical condition. It's a group of medical conditions, a group of medical symptoms. And there are many, many types of dementia. There's Alzheimer's dementia, vascular dementia, Lewy body dementia, frontotemporal dementia, and alcohol-related dementia. The most commonest is obviously Alzheimer's dementia, but we'll come to that. So we talked about it's a group of symptoms and signs. So what are the signs? So one very common sign is memory loss. At first, you have memory loss for recent events, and then it progresses to past events. You also have speech and language impediments, as that also gradually deteriorates. You have personality changes. People change their personality over a period of time, being mellowed to a different personality. It could be. They also have irregular sleep, a loss of sense of time and place. We talked about Alzheimer's earlier as the most commonest form. What exactly? Again, we truly don't know how Alzheimer's developed, but what we have seen in people with Alzheimer's, in the brains, there is deposition of certain proteins and chemicals which start to erode the brain size. You can see in the figure on the left, you can see a normal healthy brain. On the right, you can see a shriveled, shrunken Alzheimer's patient's brain, and that's because of those accumulation of proteins. Again, you have the same kind of symptoms and signs that we discussed earlier happen in this Alzheimer's. Now, in terms of being able to identify, again, it's not an easy process. What we do is we look at the symptoms and signs and do some lab tests. But again, what would be ideal is for us to be able to identify Alzheimer's very early on before it develops, or any dementia that it develops, even before those deterioration happens, and then you can intervene early, and we also have a medical treatment. But unfortunately, at this stage, there is no one single surefire treatment for Alzheimer's. What we have is only management. We don't have a cure for Alzheimer's, or for that matter, other dementias too. But we have management approaches, including validation therapy, music therapy, reminiscing therapies, but also medicines like cholinesterase inhibitors. These cholinesterase inhibitors, they prevent the deterioration of acetylcholine, which is an important neurotransmitter and useful for our memory. But again, as I said, it's not a cure. It can help with early kind of stages of Alzheimer's, but later on, as the disease progresses, it's going to be very hard to use those medications or even those therapies. We already talked about Alzheimer's. There is no cure for that, but can dementia be prevented? Again, it depends upon the particular type of dementia the person is developing, but we do know that by reducing risk factors, including smoking, high cholesterol, and high blood pressure, there's a likelihood of being able to, at least, if not completely prevent dementia, but be able to delay the onset of dementia. And also, obviously, lifestyle changes like healthy diet, physical activity, and mind activity. Now, let's look at how artificial intelligence is used to help in addressing dementia. Artificial intelligence is not a cure for dementia, but it can definitely help with some of the challenges that we have with dementia. So the way artificial intelligence can help with dementia is through three categories. One is being able to identify patterns. It can look at patterns by looking through that huge amount of data, patient data, that human eyes can miss. Artificial intelligence can find out very early on if this person is likely to develop dementia. We'll see certain examples or case studies how this plays out. Artificial intelligence also can be used to predict whether somebody is going to get dementia very early. The earlier we know somebody is going to get dementia, earlier the intervention can happen. So this is definitely useful. AI can also be used to manage dementia, those people who already have dementia at home, by using a combination of artificial intelligence, Internet of Things, and sensors, being able to ensure that dementia patients are not at risk at falling, and if they do have a mishap, that there is a warning that goes to the health services to intervene. Not just at home, but also can be used in residential care to monitor dementia patients. Now let's look at case studies. There's not huge amount of case studies, but where there are case studies, there are very promising signs that artificial intelligence can help with recognizing people with dementia early on. For example, in this particular case study, IBM and Pfizer, those companies, they used data from Framingham Heart Study, which is a famous study for medical researchers. They know that it derives data from more than 14,000 people over 3 generations since 1948. What they used that patient data from that particular study and looked at some of the people's participants' handwriting models, handwriting responses, and were able to, through that linguistic inference, textual analysis, be able to identify who of those patients could potentially develop dementia. And they actually had an accuracy of 70% being able to identify that. That's quite a bit of high accuracy in being able to predict somebody could get dementia just based on handwriting. The other study that I would like to mention is been developed in the United States, where they introduced tests that can be incorporated as part of your annual check using an iPad. So basically, they would show images of various images, and if you were to see an animal within that image, you would tap on the right, and if you didn't see on the left, based on your speed of response and your ability to identify the images, the test would predict whether you would get dementia or not. Another study from the United States, they used a tool again using handwritten responses. They asked the participants to write down textual responses to looking at viewing an illustration of a children stealing cookies from a jar. Based on the handwritten features, they were able to again identify whether the person would get Alzheimer's or not. It's not just in terms of predicting Alzheimer's. We also see in artificial intelligence being used to help with training healthcare professionals to link or empathize with dementia patients. In fact, my university, Deakin University, has developed a patient avatar so that it can be used to train healthcare professionals in responding to dementia patients. So these were just a few examples of how AI can be used to manage dementia. In the coming years, we will start to see more and more studies happening in this area and more applications being used in your routine care and management. To summarize today's presentation, AI is being used in healthcare widely. In the coming years, we're going to be seeing more and more AI applications being incorporated in healthcare. AI is not just used generally in healthcare, it's also being used to predict those people who may eventually get dementia, but also when somebody gets dementia, it's also being used to monitor them for any risks, behavior, but also it's being used to train healthcare professionals in responding to AI patients, dementia patients. So if you thought that was a quick run through AI, it wasn't enough, I do recommend you to read two of my books. The one on the left is written for a general audience. It's quite easy to read. The one on the right is a bit more academic in nature. It's an edited book where authors from all across the world have contributed and described how AI gets used in various healthcare settings. So with that, I will stop my presentation and hand it over to Anne.
Thank you very much, Sandeep. What an amazing presentation in such a short time. I just remind everyone, if they do want to ask some questions live in today's session, please post them now in the Q&A panel. I've got several that have come to me directly, Sandeep. One in particular from Tony, who's out in Western Australia and wants to know, particularly for our audience, have you been involved in any particular projects that have concentrated on community care settings?
It's a good question. I personally haven't. So it depends upon what exactly community care and what's the definition of community care. If you're talking about population health and primary care, while myself haven't been involved, definitely artificial intelligence has been used at the population health level. So one very good example is in this current pandemic, artificial intelligence was used for epidemiological surveillance. In fact, one artificial application based out of Canada was the first to identify the outbreak in Wuhan in China. So again, artificial intelligence can be used also for clinical trials in the community. It can accelerate the phase 1 and phase 2 clinical trials by pre-identifying the necessary right kind of patients, but also being able to be used for virtual screening, drug screening, and drug discovery. Artificial intelligence also can be used in primary care for transcription purposes through the natural language processing application. In that way, the doctor can spend more time with the patients. So the myriad number of applications that are currently available in both in primary care and community care.
Terrific. You answered two questions in one there, Sandeep. The other question was around its application during COVID. So is there anything further you want to add to that?
Yes. So I mentioned one is the epidemiological surveillance, but artificial intelligence also has been used in the medical imaging interpretation. We know that obviously with COVID patients, their lungs get affected. So artificial intelligence has been used in analyzing CT images to identify which of these patients have COVID-19, because you get a typical appearance called ground glass pneumonia, and artificial intelligence has been used in that area. Artificial intelligence also has been used in the emergency department to pre-screen and triage patients with COVID-19 symptoms so that they can be isolated. And there are more and more applications, but these are the prominent ones.
So we've got quite a few people who've talked to us about the opportunities to work with yourself and your research group in community-based or primary-based care. Sandeep, so perhaps we'll take that offline and have a chat to you further about that. Workforce is one that you mentioned in your presentation. Workforce is clearly a big issue. Depending on whose research you read, you know, at best we've got currently a 30,000 personnel workforce shortage in our primary healthcare sector. So to be, I guess, more productive with less resources and to have greater efficiency whilst maintaining or enhancing quality and safety is a key issue. Can you make any comments? I guess it's not only an issue for us about workforce shortages, it's also about skill development and digital literacy and maturity. Yes. So I think the questioner, who was Kathy, was really trying to indicate we've got a number of extra challenges that make the wider spread application of AI maybe much more of a challenge. Any comments, Sandeep?
Absolutely. So that's a very good comment. So one thing we need to remember is that ability to use AI or AI as a replacement for healthcare professionals is many, many years away. The media has hyped up AI to an extent. People are talking about AI replacing human clinicians or healthcare professionals. That's not going to happen. What is going to likely to happen even into the future is AI is going to augment healthcare, enhance healthcare. But back to the point of workforce challenge and digital literacy. So I don't think AI is a solution for every problem that we have. We already have existing healthcare e-health solutions like telehealth and so forth. And even those, until the pandemic, we had issues even adopting telehealth care, electronic health records. So there are challenges with that. So you can imagine there will be challenges with artificial intelligence. But having said that, artificial intelligence by nature itself is very distinct from these other applications because of those things which I talked about earlier in my presentation. Its ability to analyze data, recognize patterns, and its powerful nature in interpreting not only textual data, but image data. So it's got a multi-pronged approach. But the point and the question was about the safety and the quality process. So myself have been involved in that area. We, myself and my co-authors, we wrote a lengthy article which was published in the Journal of American Medical Informatics, talking about a governance approach, ensuring that there's data curation, the right type of data is used. But once that data is used and the model is trained before integrating into healthcare, there is an appropriate education of the workforce. People know what they're using in terms of the AI technology itself, but also if there were any mishaps or any adverse events that would occur, what would be the medical legal processes. So there's a lot of things that have to be worked through. It won't be easy, but I also think that the potential of AI, just because there are challenges, if we discard that, it will be a shame.
Thanks, Sandeep. One final question from Dawn. Dawn's an avid technology incorporator in primary healthcare. Dawn asked you, what sort of methods do you consider with the use of AI, such as in commercially available Google and Amazon, particularly where they help seniors stay in home for longer, more safely?
Good point. Thanks, Don, for that question and comment. I don't know particular products with Google and Amazon, but I do know how this technology would help in terms of supporting seniors at home. So the combination of computer vision and Internet of Things, which is another technology, can be used to help in preventing falls in senior patients by using sensors to detect if somebody were to fall. If they had a fall, then it would alert the healthcare services. There has been that incident, but it can also be used to help in providing that companionship to seniors. In fact, in Japan, it's very much prevalent using robotics and artificial intelligence to provide that social companionship for isolated seniors. We all know that it's important to engage our brain as we grow older. So that is there. That aspect is also there. The third aspect, which I personally have been involved, is being able to connect seniors to the doctors. We do not necessarily have to wait for the elders to actually visit the clinic. You can actually bring the doctor and the healthcare information directly to the elder at home through virtual assistants, through telehealth, and so forth.
Thank you, Professor. That's all the time that we have for questions at the moment. Thank you for your involvement in today's webinar. We really appreciate your time and your expertise in this area. Thank you.
Thank you for the opportunity to talk about AI in healthcare, and in specific how AI is being used to address dementia. Very much look forward to hearing back from you, Anne, and others in case there was any collaboration opportunities.
Thank you very much. We look forward to talking further. Just in finalising today's presentation, to just remind everyone that there's an upcoming webinar on the 21st of April. This is with Lauren Henley, who's focusing on enhancing community care through equal access to assistive technology. I'd like to finalise by thanking the team behind here, Georgie and Jade, who've organised the technical. Again, if you'd like to suggest another topic for other webinars, please let us know on the email address in front of you. Again, thank you, Professor Reddy, for your time today, and thank you everyone in attendance.
Thank you.